Have you ever heard this cough before? If so, you may be interested to hear this. The sound you heard is what is commonly known as whooping cough. It is called the whooping cough because when the person is trying to breathe in at the end of the cough, they make a whooping sound. The Bordetella pertussis bacteria is what causes whooping cough. Whooping cough spreads like the common cold. The person coughs, another person breathes in the bacteria or gets it on his or her hands and touches his or her nose or face. Whooping cough starts with mild cough, runny nose, low fever, and so on. After 1 to 2 weeks, the cough gets worse and becomes coughing spells lasting up to a minute. Sometimes a whooping sound is heard at the end of the cough as a person tries to breathe. Infants may experience choking episodes, and older children or adults may end up vomiting. Getting your childhood vaccinations prevents whooping cough. The DTaP is given at 2, 4, and 6 months of age, and then again at 15 to 16 months of age, and finally at 3 to 6 years old. The booster TTaP is given when a child is 11 or 12 years old, and then recommended every 10 years after that, up to age 65. Whooping cough is treated with antibiotics or use of humidifier or cool mist vaporizers. You should not smoke or use aerosol sprays or wood-burning fireplaces in the home where someone has whooping cough. The patient should drink plenty of fluids. Infants are often hospitalized because they need to be monitored closely. They may be put in oxygen tents and given fluids through IVs. The cough usually lasts 6 weeks, and it is most dangerous to infants who have not been vaccinated. If you have not been vaccinated and you are in the same house with someone that has whooping cough, you have an 80% chance of catching this disease. So get you and your child vaccinated to help prevent this disease. This has been a public service announcement.